More than 2 weeks after a stabbing at a local hospital, the paramedic injured said the violence should surprise no one.
Our I-team has found new emails and records following the attack. Tonight, our Paula Vasan speaks exclusively with the woman stabbed and asks hospital managers if they're doing enough to protect their workers.
5 staples right here. I got 5 stitches on my back. I had blood and air in my lung. I'm angry because this should have never happened. This was something that was 100% preventable. This is something that, my life could have been ended. My friend's life could have been ended.
You're hearing from Kayla McMahan, a paramedic at SSM Health DePaul Hospital.
I've been there for 10 years.
Her last day at work was July 11th. She was sitting at the triage desk when a patient she never saw before attacked her, stabbing her 2 times with a butcher knife. She saw her friend stabbed in the neck.
And then I think I blacked out because I don't remember falling.
Did you ever expect that you'd be a victim at work?
We always said at DePaul, if it's not, it was never if, it was when.
Because for years, this healthcare worker says she and her colleagues have been begging management for more security officers and metal detectors.
And it fell on deaf ears.
As they've seen violence in the ER worsen, with attacks like this one from about a year ago becoming increasingly common.
I've called security, my own security office in my own hospital, and been put on hold while I'm dealing with a screaming patient in the background because there's not enough security guards. We've told DePaul, we've told SSM that we've needed safety. We've told them numerous times, and they wrote back, well, we're looking into funding.
Action was too little too late, says her attorney, Emily Kalla.
This was a completely foreseeable event. This was a completely preventable event. And the measures that should have been in place to take care of their medical staff were not in place.
After more than 2 weeks of asking SSM Health leaders for an on-camera interview, they agreed.
Our top priority is always protecting our staff.
Since the stabbing here, Dr. Alexander Garza says the hospital system has hired more security officers, added metal detectors, and enforced more training.
Many healthcare workers had reached out to me and said they've been begging management for help for years, for more security, but nothing has been done. Why do you think they experienced that?
We're pushing up the timeline on when these things get rolled out. Part of that is listening to the staff, seeing what the issues are, and then acting on them. We're not going to rest until we take care of them and that we can provide that security.
For too long, McMahan believes hospital systems have often put profit over people. It's why she says her colleagues continue to work after witnessing the stabbing, cleaning her blood off the floor, even though internal emails we obtain from staff tell a different story. This email from SSM Health Management to staff soon after the stabbing says, leaders immediately began working with staff members most closely affected to allow them to go home and begin to process what had taken place.
No. And they sent nobody home. My coworkers that were forced to help save my life had to finish their shift.
It's why she says she's speaking up for coworkers, for herself, and for healthcare workers everywhere.
I don't want this to ever happen again. That shouldn't be a thing. We shouldn't have news stories of nurses being assaulted.
McMahan is now preparing to file a lawsuit, alleging violence against staff has increased and not enough was done to protect them. A spokesperson with SSM Health says they can't comment on pending litigation.